हेलो दोस्तों, वेलकम टू सुमित फ्लिक्स। आज की इस वीडियो में आपको मिलवाने वाला हूं एक मेडिकल फील्ड के प्रोफेशनल से। ही इज़ अ नर्स बेस्ड इन सेंट्रल लंदन। इस वीडियो में हम जानेंगे कि इंडिया में आपको कौन सा सर्टिफिकेशन देना है, किस टाइप की पढ़ाई करनी है, कितने आपको आइलेट्स के बैंड चाहिए, यहाँ पे आके आपको कौन सा सर्टिफिकेशन देना है, कौन सा एग्जाम देना है। इन सब चीज़ों के बारे में आज हम इस वीडियो में डिस्कस करने वाले हैं। इस फील्ड में आपको वीज़ा स्पॉन्सरशिप के लिए बिल्कुल फाइट नहीं करना पड़ेगा, बहुत ईजिली आपको वीज़ा स्पॉन्सरशिप मिल जाती है। तो आइए सुनते हैं लाइव एक्सपीरियंस। और लाइव एक्सपीरियंस सुनने से पहले मैं आप सबको रिक्वेस्ट करना चाहूंगा कि आई नो आप लोग मेरी वीडियोस देख रहे हैं और पसंद भी कर रहे हैं, तो प्लीज सब्सक्राइब करना भी ना भूलें। तो आइए सुनते हैं लाइव एक्सपीरियंस।
Okay. So, hello, Will. Super thanks for doing this interview with me today. I know I'm just starting my YouTube channel and this is just the initial phase, but I really appreciate that you're giving me some time out of your busy schedule. So, I promise I won't take much of your time. So, we will just directly start this with this. So, tell me how
Okay.
you're doing.
Yeah, I'm good. Thank you. I'm happy to help you and the background of educational purpose.
Mhm.
I'm doing this kind of interview very first time, so I feel a bit nervous.
Don't worry.
No worries.
Okay, so please tell me something about yourself. Like, where are you from India? What kind of job you were doing in India, and what you're doing in UK at the moment?
Yeah, I'm working here, and I have been working here since 2014. So it has been 6 years now, and I have got the indefinite leave to remain.
Okay.
Before I come to UK, I have completed my nursing
Hmm.
uh, as undergraduate. That's
Okay.
called BSc nursing.
Okay.
It's a 4 years program. So I have completed. After that, I worked for some hospital in Chennai.
Hmm.
Then I did my post graduation. After post graduation, I came to UK. But
Okay.
post graduation is not a mandatory qualification to come to UK. Just you should have basic nursing. That means undergraduate. That's enough
Okay.
for you.
Okay. How did
Yeah.
you choose the course? Like, did you have any kind of help with some overseas study consultant in India, or like you managed everything on your own?
No. I managed on my own. My senior, I know him before I started my undergraduation.
Hmm.
So he helped me the scope of nursing in abroad.
Okay.
So just in aspect of getting job in abroad, I chosen this course.
Okay. Okay.
So yeah, so everything I set my
Hmm.
goal prior to start my course.
Hmm.
So it went well so far,
Okay.
and I hope in future as well it goes very well.
Okay. 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 So you directly applied from India.
Yeah. So
Ah.
actually, there is a agency called IITR in Delhi.
Okay.
So if you keep on chasing the recruitment agency, the reliable one,
Hmm.
they used to visit many places like Cochin, Chennai, Bombay, and New
Okay.
Delhi to recruit the nurses for UK.
Okay.
So if you send the resume with them, and if you keep on tracking them, they will shortlist your name,
Hmm. Okay.
and they will, yeah, let you know the interview date and the thing. And they have a type with the recruitment agency in UK.
Okay.
So both the recruitment agency from UK
Hmm.
and India, and the NHS trust people, they will be coming together to conduct the interview.
Okay. 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 So I assume this whole interview process and everything was online for you.
No, it was 2014, so they came to India directly. It was a face-to-face interview.
Okay. Okay. So you have everything in India. Like this NHS team came to India for the interview process, and you.
Yeah, that's
Oh,
true.
okay.
That's
That's
true.
nice. So I was asking, I was coming to the main question most of the people have is about the visa sponsorship. So did NHS provided you visa sponsorship or was there anything else done for you?
Yeah. They have provided me the visa and the thing.
Mm-hmm.
So before you apply for the visa, you should have COS. That's called a certificate of sponsorship.
Yes.
So once you pass in interview,
Mm-hmm.
once you have been selected,
Mm-hmm.
the NHS trust will apply for a COS on their own cost, their
Okay.
cost. Then they will send you the COS, and with the COS, you can apply for the visa. So
Okay.
as the nurses or the nursing profession is under the shortage of occupational list,
Yes.
definitely you will get the visa for 2 to 3 years initially.
Okay.
Then after that, you can extend for another 3 years. So by the time when you spend 5 years here, you
Mhm.
can get the indefinite leave to remain like other profession people.
Okay. Okay. So for visa, like how much time it took you for like the whole visa application process, and like did you have any visa interview or anything like that?
No, usually they don't conduct interview nowadays.
Hmm.
They used to conduct interview for a long time ago, but
Okay.
nowadays they are not conducting any interview as far as I know, because
Okay.
I didn't attend any interview. Just it's online. Just you apply online. Then
Okay.
on the day of appointment, you go and produce your documents.
Okay.
Then they will let you know whether you have been granted visa or not. That's
Okay.
it.
Okay.
But I'm sure for nurses, they don't reject the visa for any reason,
Okay. Okay.
because you have a privilege.
Yeah.
Unless you produce all your documents,
Mm-hmm.
even if you have any lack of documents, they let you know, so you can submit the documents additionally,
Okay. Okay.
the visa.
So you have special treatment for medical staff on the visa side then.
Yeah, it's a
You can
kind of, but
say. Okay.
they treat everyone equally.
Yeah.
So, but before the visa, I want to talk about the English requirements, English
Yes.
test requirements. That's the main thing.
Yeah.
That's the only thing we are getting afraid of,
Yeah.
because you know, uh, some people they are getting afraid of English,
Mm-hmm.
because the other profession they don't have English requirements like IT profession, I think.
Mm-hmm.
But for nurses, because they need to spend more time with the
Exactly.
nurses,
Yeah.
doctors, and other multidisciplinary team,
Mm-hmm.
their English should be at a professional level.
Mm-hmm.
So as soon as you complete your degree course,
Mm-hmm.
you can start to focus on your English exams like IELTS.
Okay.
So if you pass in IELTS, yeah, the score should be 7 in all band. They
Okay.
have some exception in writing. You can have only 6.5, but in other three bands you should have 7.
Mm-hmm.
And recently, the Nursing and Midwifery Council UK added one more exam. It's called the Occupational English Test. That's
Okay.
called OET. In that, you need to get band B in all the sections like reading, listening, writing,
Okay.
and speaking. You should get B bands in OET.
OET.
In yeah, in occupational English test. That's called. Yeah,
Okay. Okay. I wasn't
yeah,
aware of that. Because
yeah.
I mainly heard about IELTS people talking about more on that
Yeah, in
side.
IELTS you should have a 7 in all section,
Okay.
but writing you can have 6.5.
Okay. Okay. Okay.
So yeah, so that's a main requirement.
Mm-hmm.
Once you get uh, certificate, that means IELTS certificate
Mm-hmm.
with the desired qualification, you can approach the Nursing and Midwifery Council UK for registration.
Okay.
So once you have done the registration, you need to do CPT exam. That's called computer-based test.
Okay.
So when you have passed the IELTS and CPT,
Mm-hmm.
you can apply for the job with any trust.
Okay.
So once you have been selected in interview,
Mm-hmm.
the trust will apply for the COS.
Okay.
Yeah, so once you get the COS, you can apply for visa. The applying for visa is entirely the student. That means the individual responsibility. That means
Mm-hmm.
your responsibility.
Okay. NHS
Once
is
you,
responsible to provide you the CUS, but after that, everything should be managed on your
yeah,
side.
yeah, yeah,
Okay.
yeah.
And
From the
for your visa fees and everything, did they manage that, or even you have to manage on that side too? Because I
No,
recently I heard
some,
there are some changes on the visa fees and the health surcharges, especially during the COVID time. But I
yeah,
assume
yeah,
they were
yeah.
already there
For
before.
during COVID time, they have given exception for nurses and other healthcare professionals
Okay.
that they don't need to pay for the surcharge, IHS, that's called.
Okay.
But before that, they used to pay the money.
Okay.
But the thing is, some of the trust, they are paying your visa charges as well, but
Okay.
some trust, they don't pay.
Okay.
So
Okay.
it's complete. Some people, it's not your right to ask the trust to pay your visa fee,
Mm-hmm.
but sometimes if they need you really,
Mm-hmm.
they will pay you the visa charges.
Okay.
But usually you don't need to expect from them that they can
Okay.
pay the visa fee.
Okay.
It's your pocket money.
Okay, okay. So it depends like from employer to employer, we can say, because
Yeah,
even
yeah, yeah,
in IT, like some employers give you like even the visa fees and even your flight tickets or the relocation and everything, and some don't. Like you just get the visa sponsorship. That's the only thing you get.
yeah.
So
That's right. That's right. It
okay,
depends on the completely depends on the employer
yeah.
which you choose.
Hmm. Okay,
Even here, when you after coming here, you if you want to change the trust, even for that, some trust they are giving like relocation charges, like
yeah,
£2,000, £3,000.
exactly.
They are if you move from one place to another place, they are
Hmm.
giving the extra money
Yeah,
because they need you
yeah,
more.
exactly, exactly. So you mentioned about IELTS and the English exam. So um, what I like, I assume your degrees in India, the graduation and the master degree in India was in English medium. So
Yeah,
even after that, you need to give the IELTS exam.
yeah, yeah, definitely, definitely, because the India is they have given some exception for some countries like Caribbean countries
Hmm.
and Australia, New Zealand, and some Caribbean countries. They have got some exception because
Okay.
their medium of instruction and mother tongue it's like English.
Hmm.
But for other people, they need to pass in the English exam.
Okay. That's strange because I have my one of my friend. She got a job from India to UK, and she didn't give it any IELTS exam, and she just presented her degree certificate, because her the the degree was English medium. So and she proved it, her English skills from that certificate. She didn't pass any IELTS exam, so I'm really surprised on that front. But yeah, I completely understand it's a people profession, and you should speak the language nicely. So maybe
Yeah,
that's the reason.
yeah.
Okay.
Because without IELTS, it's impossible to register with Nursing and Midwifery Council. So
Okay.
when you approach the Nursing and Midwifery Council, that's the first question they will ask you: Have you passed in the IELTS exam?
Okay.
Then only they start the registration process.
Okay.
So once you start the registration process, they give you like a decision letter.
Okay.
So that's from the NMC, Nursing Midwifery Council. So with the decision letter and the COS, you can apply for the visa.
Okay.
Then once you come here, you need to pass another exam that's called ASCII. So it's a kind of practical examination. So once you start the job, you will be paid as band two salary.
Okay.
So once you pass in the ASCII examination, you will be paid as actual nurse pay. That means band five. So when you
Okay.
start the nurse, you will be called as band five nurse in
Hmm.
UK. So before that, you will get the pay like a band two salary, it's like a healthcare assistant job.
Okay.
So they
Okay.
will wait until you pass in the ASCII exams. So once you pass in the ASCII exam, so the trust will approach the nursing council
Hmm.
and they will give the PIN number that's called personal identification number. So
Okay.
once you get the PIN number from the NMC, you will
Hmm.
be paid as band 5 salary. You will be paid as band 5 nurse.
Okay. Okay. So I
So
assume
the
like you have like a uniform salary structure in your profession.
yeah, yeah, yeah.
Okay.
So it's like But the thing is, if you work in London, you will have extra money. It's like a high cost allowance.
Mm-hmm.
But if you work outside of the London,
Mm-hmm.
your pay will be different
Okay.
because you don't get the high cost allowance.
Okay. Okay. Yeah. It's expensive city, so
Yeah,
that is
yeah, because
completely
you will
understandable.
get, yeah, you will get 20% of your pay as a
Mm-hmm.
high cost allowance, extra money is a
Okay.
20% if you work in inside London. It means central London.
Okay.
In other parts of London, you will have 15%,
Okay.
but if you work in central London, you will get 20% of your pay as a extra money
Okay. Okay. Good to
without
know.
your expenses. Yeah.
Okay.
So
So
regarding the sorry, one more thing I
yeah,
want to
please
tell
go ahead.
you regarding ASCII examination.
Mm-hmm.
The trust will sponsor you for 2 times.
Okay.
Yeah, because it comes around £900 in UK money.
Mm-hmm.
So they will sponsor you for 2 times. If
Okay.
you fail 2 times, the third time you need to pay from your
Yeah.
side.
So, okay.
If you fail in all the 3 attempts, you need to go back to India.
Okay.
Then you need to come back again.
Okay. So you need to do the whole process again.
Yeah, you need to go. No, you don't need to do the IELTS again,
Uh-huh.
but you need to apply for the job again.
Okay. Okay.
Yeah, because they have given you 3 chances. In all the
Mm-hmm.
3 chances you have failed,
Mm-hmm.
so they will suspect your qualification.
Okay.
So
Okay.
you need to do the process again. That means just part of the recruitment process.
Okay. So
So
overall, it's the main thing is like IELTS, and then we need the CPD that is given directly in India. That's an online exam, you said, and then we have this SKI exam,
ASCII, yeah, ASCII. That's called ASCII.
ASCII. Okay,
Yeah.
which is done here in UK after you come up here in India.
So
Okay.
once you get the ASCII, that means you're working in the trust as a band 2.
Mm-hmm.
That means healthcare assistant.
Okay.
So as a part of your job, you can go to any university or any private people. They will give the training on ASCII.
Okay.
So you can attend the study days and you can attend the exam.
Okay.
So once you come here, after getting visa, you can start to work as a healthcare assistant. But
Okay.
during the work time, you can attend the study days. You can take some extra effort to pass in the ASCII.
Mm-hmm.
So once you pass in the ASCII, you will paid as a band 5.
Okay. Okay. That's quite interesting to know. Um, okay.
Just I want to make sure that I am explaining you very clearly.
Yeah, that's really nice actually. Like I'm not from a medical field, and I don't know anything about you said like, and it's quite interesting to know. I think it'll be interesting for people from your profession who are in India and who are trying to come here. So it could be quite interesting for them.
Yeah, just I want to make sure whoever listening this one, they
Yeah,
they should follow up the explanation what I am giving to you.
yeah, yeah. That's really
Mm.
nice. Okay. And apart from all these three things, like after you have this your personal identification number and everything, so is there any other further trainings or certification you can do, or
Yeah, but the from the trust they will give you the induction. That means like 3 days, 4 days they will give the training.
hmm.
They will tell you about the trust. They will tell you about the UK life. They
Okay,
will teach you about the all the protocols, procedures to be
okay,
followed in the hospital.
hmm,
So you can't start the work straight away.
okay,
Initially, they will give you a lot of support,
hmm,
yeah, and they will give you some study days.
okay,
So, so when you have gone through all the study days and training
hmm,
thing, you'll be very comfortable to start your work. Even when you start to work, you will
hmm,
have a support from the other nurses,
hmm,
like clinical educators or other PDN. They call the PDN professional development nurses.
hmm,
They come to your ward and they will check how you are progressing, and they give you enough time, and
okay,
they will do some assessments. Really, when you're ready to work as a nurse, So
Okay.
it's like they called that as a supernumerary period.
Mm-hmm.
It depends on the trust. Some trust they will give you 2 weeks.
Mm-hmm.
For 2 weeks, you don't need to work alone. You will do some shadow shift. That means someone will support you,
Mm-hmm.
someone will guide you. Just you will be treated like supernumerary. That means you are not counted as a number in numbers.
Mm-hmm.
It's like someone will support you.
Okay.
Yeah.
Okay.
After 2 weeks, yeah,
Mm-hmm.
they will do some kind of assessment. It's like a
Mm-hmm.
formal assessment. Then they will take a decision. Um, if they are happy, you can do the shift alone. Or if they are not happy, they will extend your supernumerary period for 1 week or 2 weeks.
Okay.
Then they will do the reassessment. Then they will allow you to work as alone.
Okay. I think it's even we have the similar kind of thing in IT. Like we have the like shadow support or shadow training. So one of the experienced person will sit with us during the whole the
Yeah,
initial
that's
period,
true. That's
and they'll help us out to get on on lines and yeah to get experienced with the job.
Yeah,
Okay.
we call that as a supernumerary period.
Supernumeric. Okay.
Yeah, yeah.
Okay. So that was about whole process and everything. So can you please tell us like what is your like a day look for you? Like what kind of activities and responsibility are as a part of this job?
Yeah, actually I work in central London, so I do only long days and nights.
Okay.
In other parts of UK, they do the early shift, late shift, and night shift. But
Mm-hmm.
in London, because of the traveling restriction and the thing,
Mm-hmm.
they we do only long days and nights.
Okay.
So yeah, I'm quite comfortable with the job what I'm doing now.
Mm-hmm.
So I have a good team in my unit.
Mm-hmm.
So I'm not having any kind of stress related to work.
Okay.
So I go to work, I do, and I come back. When I come back
Mm-hmm.
home, I don't have any stress related to work.
Okay. That's
Yeah.
that's nice to hear. But I know like especially at this time like there's lot of work and you guys might be like super busy, so it
Yeah,
can be challenging.
but in some kind of professions, even they come to home, still they need to work.
Yeah.
But in nursing profession, you don't have any kind of stress.
Yeah.
Once you
You
are,
can't work remotely, so either you have to be there or you don't have to be. So
yeah.
yeah.
But initial stage, you need to work out some kind of thing at home.
Mm-hmm.
As when it's a supernumerary,
Mm-hmm.
you need to read some books. You need to go to the trust policies and the thing.
Mm-hmm.
But once you're fully qualified, you don't need to, unless you're interested.
Okay,
Yeah.
that's on the individual side, as I assume.
Yeah, regarding hospital side, when we go there, we do a handover.
Mm-hmm.
So we get the handover from the night staff,
Okay.
and after that, medical team come for the rounds.
Mm-hmm.
Uh, they will ask you about your patient, and just they will ask you if you have any concern about your patient. So if you have any problem with your patient, you can let them, you
Mm-hmm.
inform them, then they will sort it out.
Okay.
And after that, you will have a breaks for 30 minutes,
Mm-hmm.
breakfast, lunch, and dinner.
Mm-hmm.
And after that evening, again, they come for the rounds. If any changes, you can inform them.
Okay.
And when they come for morning rounds, they will tell you the plan, what we are going to do for the particular patient. So
Mm-hmm.
you can execute, and they will put it in the care plan, and you can execute. And you will have physiotherapy, occupational therapy, and pharmacist and dietitian. They all work together. So dietitian, they come and check what kind of food patient is eating, is it nil by mouth, and
Mm-hmm.
any special dietary requirements. And the physio come and they assess the patient's walking ability, whether they can walk, they need any kind of special instruments like Zimmer frame or walking stick.
Mm-hmm.
And occupational people come and they morely they mainly work on a post discharge. Like once the patient reach home,
Mm-hmm.
everything is set up for patient's facility. So they want to make sure everything is set up before the patient discharge. So all the NHS trusts work on safe discharge because it's not like back home. Once you discharge our in back home hospitals, they think that their responsibility is completed. But here, once they discharge, still they follow up completely
Mm-hmm.
uh, with the other recommends as well. They
Okay.
want to make sure the patient has got a care package, or some home the nurses come
Mm-hmm.
to treat the patient at home, and so care workers come to help with the patient. So it's a lot of things involving even after the discharge.
Yeah. Okay. Yeah,
Yeah.
that's a big difference between here and India. So now you worked here for quite some time, and you did you work in India as a nurse, or do you don't have any experience for India, or you
Yeah,
just
yeah, yeah. I worked in Chennai, but I don't want to name the hospital. Yeah, it's
okay?
a big hospital. Uh, Yeah, but I have a good experience from the hospital where I worked.
Okay.
I can tell the hospital number. I have no problem with it because I was a good employee there. It's a Chennai Apollo Hospital.
Okay. That's
Yeah,
nice.
Chennai Apollo. So it's a the thing is when you work or study in India, it's better to move to the metropolitan cities
Mm-hmm.
for your job. So because they in metropolitan city only the people come from abroad. They focus on interview.
Mm-hmm.
So for example, I don't know whether you know the name of the city, Madurai.
Yeah, I know.
So I'm from Madurai. So
Okay.
but if, I've for my job I moved to Chennai
Mm-hmm.
because Chennai is one of the metropolitan city.
Yes.
So from there, you can search for a job, particularly if you have an idea to come to abroad.
Mm-hmm.
So you should select these kind of cities like Chennai, Mumbai, New Delhi.
Mm-hmm. Yeah, definitely. Like a bigger metropolitan city offers you better job opportunity as compared to a smaller one. So
Yeah,
that is
yeah, that's
completely understandable. So you have experience working in India and you have worked here in UK now.
true.
So what kind of differences you found, like from a professional and personal front?
Yeah, because in India, as a nurse, you have some only few responsibilities.
Hmm.
But here in UK, as a nurse, you have more responsibility.
Hmm.
You are part of a team, and you will have more respect than the nurses in India. The way you treat the people treat you,
Hmm.
and yeah, the you will have more respect in your profession
Okay. Yeah.
than in India. I can tell this one definitely because I had the same experience how I felt as a nurse in India, and I can feel the difference how I was treated there and how I am being treated here.
Hmm.
But the only thing is if the home feeling, that's it.
Yeah. Yeah.
You work,
That's
yeah,
always a part of you. So
yeah. When you work in India, you have that you are in own home.
yeah.
But here, you stay away from your home and your family
Yeah.
and the thing. But profession-wise, uh, if you go to other countries,
Hmm.
particularly nursing, you'll be treated as a good person. As a you feel you feel uh, yourself proud.
Yeah. No,
Yeah.
I can completely understand. I completely relate.
But even in India, if you go to the government job, you
Hmm.
will be paid uh, in a good way.
Hmm.
But if you do the jobs in private setup, you don't have a adequate pay.
Hmm. Okay.
Yeah.
Well, that I have a different opinion on that, but yeah, you're from a different world, I would say, so you can have a different opinion on that front.
Yeah, because in IT profession, you don't have a private sector and government sector.
Exactly.
You
But
have a government.
you still do have, but on the salary perspective, or on the benefit side, like they're like more on the private front, because you have more profit. Maybe in the initial stage you have to struggle a lot, but once you are settled, so you get good benefits.
Yeah. Because if you have a chance, have a chance to go for work for government, you can go for that.
Yeah.
But if you have no chance to work for government, it's better to come abroad, work for some time, then you go back.
Yeah. Anyway, like there are very, very, very less chance. Like not everybody gets a government job, so even that's difficult to land. So yeah, you have to look out for your options. I completely understand that.
Because I'm telling the opinion in my perspective, but people may have different perspective.
Yeah.
But I'm not responsible for that. Yeah.
Definitely. Okay,
Yeah.
so now we were talking about benefits. So, if you don't mind, like, I know I should not ask for your salary or anything. So, can you just like tell us like what kind of benefits you get, like in the COVID-19 phase, like the key worker things come into picture, and like there are like certain benefits given. So, what kind of benefits, like even the normal time or the COVID time, you're getting?
No, actually, unfortunately, nurses are not included in the pay rise after COVID. Yeah,
Okay.
because before that, nurses has got a pay deal with the government. Actually, their pay deal was scattered into 3 years.
Okay.
Actually, they gave us a 6% salary hike, but this 6% is broken into 3 years. So
Okay.
we got in the deal, but
Mhm.
post COVID, they have given the pay hike for doctors, other healthcare professions, but they have not included the nurses because already we have got a deal. But now
Okay.
we are doing a protest, a series of protests. So far, we have done 3 protests, but still we have not heard any good news from the government.
Okay. Well, I wish you all the best for that. So and I hope you hear some good news in the coming days. Okay.
Yeah, and still the nurses felt that we didn't get any immediate attention for our protest.
Mm-hmm.
Media came to us very late
Okay.
to to inform our demands to the government. It didn't reach well among the people, the
Yeah.
public.
Yeah. Like
Were,
I haven't heard about anything from last 1 year. I haven't seen any news on BBC or read anything online. So.
yeah, that's true. That's a true thing happen here because usually we are not allowed to do any kind of strike or any kind of uh, thing. We can't stop the work suddenly.
Mm-hmm.
That's not our professional ethics.
Okay.
We
Okay.
are doing stage by stage.
Okay. So
Yeah.
I need to think about this last discussion we had. So maybe I need to cut that part if that's controversial or the not a part of the job. Maybe then.
No worries, no
Yeah.
worries. Yeah.
Okay.
But
Okay.
yeah, here you as a nurse, you have the rights to talk about the thing.
Mm. Okay, then it's good to know. Okay, so I think I've taken so much of your time, and my last question for you, like, what kind of advice you can offer to the people who are looking for a job in UK from India?
Yeah, but as soon as you complete your bachelor degree, you should focus on your language, particularly English language.
Mm-hmm.
So if you are good in English, there is no other obstacles to come to UK.
Okay. Okay.
So just my piece of advice is to focus in your English
Mm-hmm.
when you are doing your degree,
Mm-hmm.
and you should be very fluent in your writing, reading, speaking, and listening as well.
Mm-hmm.
So I would like to advise the people who come to UK, just for the people who are working in hospital side or people who are doing the studies,
Mm-hmm.
just focus on your English thing. So that's only obstacle we have as we are Indians,
Mm-hmm.
because many states still we are studying on our own medium in like a state syllabus. And few people, they are studying in their English medium or CBSE syllabus and matriculation, different kind of syllabus they follow. But the people who studied in English or matriculation CBs, they don't think about to come to nursing job. they want to go for different profession. So just I want to tell you that just focus on your English language, and you just make up your mind to come to abroad, work for some time, and go back. So definitely you feel the difference, the way you get the treatment from the people and the society.
Yeah, I think that you can, if you're going back, you can take these things, nice things with you. And I think maybe even if you're able to, implement 5% of what you learned here, or what kind of experience you have here in your workplace in India, that will be like really nice for everyone. And maybe after some time, we'll see the change that we all want to see.
So I want to conclude this one, if you're ready for that. So this is whatever the thing I told, that's my experience from my perspective. But this is not the whole experience about the people working in UK. So this is from my part of life, from my part of work.
I completely understand that. Yeah. Everyone have did their own stories, so and nobody's same. So,
but still the recruitment process are still the same.
Okay. Let's see. Okay then. I think that's it from my side. Thanks again for joining me, and I really appreciate you giving me some time after a busy schedule. And big thanks for your noble service for the society, and I think you're doing a wonderful job. I wish you all the very best for your future plans, and I hope the government listens to your demand quite soon, and you get a nice news soon.
Yeah, I hope we will get the good news soon.
Great. So
thank you for the interview. Thank you for the interview. You give me a chance to do this kind of interview first time. So I hope it's really helpful for you and the people who are listening to this interview.
I hope it is. I think definitely it will be, because I'm getting some requests everywhere, and the people are asking for this profession. So I'm really happy that I was able to talk to you, and it was a nice experience for me too. It was a new learning thing for me.
Okay.
Thank you so much.
Thank you.